So welcome everybody to the first session, session one of a four-part session that we are running around how to engage in digital health and how to use digital health, and particularly how to do that in the current situation, in the current circumstance. So taking into account the challenges around working in physical isolation and physical distancing, and how we can still provide a really purposeful and meaningful service in that time. So before we do anything further though, I would like just to acknowledge the traditional custodians of the land on which we are all meeting and all situated today, and pay respects to elders past, present and emerging. And before we get stuck into anything, we are going to do some quick little polls, right? I don't know if you know this, but Zoom has a poll option. And we just want to get a little bit of a sense of where people are at in terms of their learning and knowledge. And then we'll do another quick poll at the end. So again, we get a bit of a sense of where you're all at. So it's like the pre and post survey. And it should be super easy to use, right? So we're going to test one out first. I'll just pull it up. And I'm going to launch this. So we have a poll in progress. If you're able to answer that poll. This is obviously just a test, right? This is nothing about the training.
You're tricking everyone, Naomi.
Hey?
You're tricking everyone.
Yeah. Cool. Okay, I think we've all voted. Let's share results. The clear winner there is going to the beach and then the hairdresser. It's a pretty close second. And the next poll will just be that question around how you are. Hang on a minute. Yes. And polling. Cool. So if you could just answer whichever one of these responses, pick the response that best represents your current level of confidence in using digital health. All right, I think that's about where we're at. I think there's one more person. All right, let's share this. So it looks like, you all feel a little bit confident. You feel like you may be, feeling reasonably good about where you're at. And hopefully we can give you a little bit more help with that today. All right, now I'm just going to open up our PowerPoint. We won't be doing PowerPoint for the whole time, promise. I'm assuming everybody can see that okay? Obviously this is hopefully what you signed up for. Yep. First of four series, first of four sessions. And this is effectively what we'll be walking through. So even if you're not actually registered for these sessions, we'll be recording them and popping them up on the YouTube channel. So if you're not able to participate directly or live, then you'll still be able to watch them. Obviously today we're looking at an overall introduction to using digital health, but also having as I should say, we're aiming to make these sessions as interactive as possible. So it's not just a webinar, it's not a passive being spoken at. We really want to encourage people to communicate. So I think there's some real practice wisdom in the room or in the room on the screen that we can hopefully encourage people to share and you can learn from. Next week, we'll be looking at the clinical considerations of digital health and what that means in terms of managing risk, in terms of harm minimisation, and particularly in terms of self-care and your own personal boundaries, or your teams as well, if you're in a management position. And we'll be bringing in a few people to speak and join Jane and I as well with this. Some people, I guess you would call experts in these spaces, but certainly for weeks 3 and 4, where we're looking at increased representations or presentations of dual diagnosis and experiences of mental distress, and also that focus on identification and how to manage risk when it comes to experiences of family violence. So that's what we have coming up over the next few weeks. And we will be putting out information on the VADA YouTube channel as well.
So I guess, you know, just in terms of what Naomi's saying, it's not like didactic training that we're trying to do today. We've only got an hour. I guess what all 4 sessions are designed to do really are just to be a response to, you know, what is an incredibly difficult situation for everybody. Not just your clients, but, you know, for all of us as well, who are all having to adjust to different situations. So that's why, look, I'm probably going to do 15 minutes of slides or so, and we'll go over some of the basics of digital health, and, you know, what's been a learning process for everybody. And then we'll open it up for the rest of the session, and we'll just have some facilitated discussion around the fact that the situation we're in at the moment is actually an entire paradigm shift. It's not just that we're having to do, you know, make one change in one part of our lives. We're having to completely change the way we do, you know, a lot of things. And that involves a whole, I suppose, change in thinking. So yeah, we'll get, I suppose, your thoughts on that as well, and try and stimulate a bit of learning from each other in terms of you know, what you're doing, how you're coping, how you're managing. Okay. So in terms of digital health, can you, Naomi, can you go to the next slide? Oh, okay, all right. This is just a bit of fun to start off with, and I mean, it's really, we've all been thrown completely in the deep end with everything. And, you know, I say that about Naomi and I, you know, and I mean, even at VADA, you know, we're not even doing direct clinical work with clients. You know, we're kind of in behind the whole process. But we've all had to move and work from home, and it's meant huge changes in both our home lives and our working lives, and how we communicate with each other and what we do. And in addition to that, there's also, you know, obviously all the anxiety around the virus itself, you know, and what that means for us and our families. So yeah, deep end it is, but I'm sure that most of us are going to be able to learn to swim pretty quickly.
We'll look for the supports like this nice set of stairs, because it will be there.
Yes. Okay, I mean, look, in terms of digital health, there are lots of words that people use to describe it. You know, it can be anything from internet-based, telehealth, online counselling. We also hear about lots of other things like WhatsApp, Messenger, texting. Some are, I suppose, what they're referring to, or what the first bit refers to, is the whole concept of a clinician working with a client who is in a different place, so in different locations. So they're not face-to-face in an office, but, you know, they may be sitting at a computer, or it may just be texting over a phone. And so that relates to internet-based and online counselling and telehealth. And both the Commonwealth Department of Health and the Victorian Department of Health and Human Services have actually had definitions of what constitutes telehealth for quite some time, in fact, for several years up on their websites. That is because telehealth has actually been offered as a medical thing for quite a period of time, and I think that there's also been Medicare items based around telehealth, because out in regional rural Australia and in the outback and so forth, they've actually been doing this for quite some time. It is different in the sense that it is very medicalised, and both departments' definitions are very medicalised. But look, the objectives are pretty much the same. You know, I mean, we all want to improve patient outcomes. And, you know, I mean, if the reality is that, you know, online therapy is actually better than no therapy at all. So You know, I think any contact with a client usually will improve outcomes. Support the delivery of quality of care, and make digital health use a viable alternative to traditional service delivery. And look, that's an interesting one, because I think up until now, it's very much been like an adjunct to traditional types of face-to-face care. What I think is probably likely to happen from the COVID-19 pandemic is that there will be a shift in practice that will be lasting. And, you know, I think certainly there will be some types of evaluation of what worked and what didn't during the pandemic. And there are going to be things that will make our work much better, much more efficient, and have better outcomes for clients. And that may well include some ongoing types of telehealth and telecounselling. And yeah, so anyway, look, it's a situation that's evolving all the time. So there are, in fact, a number of pros to digital health. Some of those pros are cons, but I'll talk about that in a minute. It can work very well in rural and remote areas. And, you know, we all know that driving great distances takes up a lot of time and cost for both practitioners and for clients. And you know, a lot of our clients don't have access to cars or licenses and so forth. It has also been demonstrated as being as effective as face-to-face interactions in a lot of studies. Now, having said that, there probably haven't been a huge amount of studies. It's something that I think we will get a lot more, as I mentioned before, out of the pandemic. That there will be a lot more studying in terms of how it directly influenced patient and client outcomes. But certainly the preliminary evidence is that it's every bit as effective. And when you think that we've also had, I suppose, online platforms for and telehealth platforms for quite some time, like Lifeline is a good example. And I think, you know, they've always been telephone based, and yet I think they could probably demonstrate some good outcomes with their clients. There's the privacy, convenience and comfort of being in your own home. And I guess that generally means you don't have to get up and drive to an office and sit in a more sterile environment. And yeah, you can set yourself up in whatever room of the house you want to. So I guess but as I will also mention, it can be a con. And digital health can also be used for both individual and group sessions. At the moment, it's probably more widely used for individual sessions. And there's certainly been quite a lot of debate through the entire sector. And I mean, this has come from a number of meetings that I've sat in on with AOD managers and so forth, about what type of telehealth to use for their group work. And the jury is still out on that one, actually. Yeah, different people are trying different things. So in terms of the cons, obviously not all of our clients have access to devices, and also even if they have access to a device, they don't necessarily have credit, they don't necessarily have data, and you know, it might not be their phone, it might be someone else's phone, and so it makes it quite difficult sometimes. One thing I will say, and this has only just been announced in the last few days, and that is that there was $60 million announced for mental health via the state government, and 2.6 million of that is actually going to the AOD sector for the purchase of devices and data. Now, DHHS haven't actually, they're in the process of developing the guidelines around eligibility for that, but hopefully that will actually be coming online fairly soon. So, you know, I thought that was a really, really good announcement and well needed. There's the absence of visual and non-verbal cues, and that's Again, I mean, look, it can be a bit of a hindrance, because I think, you know, certainly those of us who are trained in counselling do rely a lot on body language and you know, the visual context of making eye-to-eye contact. Having said that, I mean, it's not necessary. It just means that you have to work in a different way, and that means quite often that you have to perhaps hone in on your listening skills, and perhaps slow down a little bit with your client, and you know, even I suppose strategies like teach back, where you ask your client, you know, to repeat back what you've just said, so you get the impression that they've understood what you've said. Technological difficulties, security and confidentiality, that's a problem with any platform. Some are less secure than others, and certainly from the meetings I've been in, I think different agencies are approaching it differently. Some agencies are allowing the use of Zoom, some aren't. Some agencies are using things like Microsoft Teams. Again, some of that comes down to personal preference and whatever with the agency. And look, not all clients may be suitable, and I guess that's really difficult in times like these, where you know, almost everybody is forced to use these types of technologies. So people with acquired brain injuries, people with intellectual disabilities, some of those in crisis, and particularly those in family violence situations. And I won't go into that today, because we're actually going to spend the 4th session on family violence, and that will specifically look at managing those types of risks. Okay, so there are lots of tools, as I mentioned, and you know, those include WhatsApp, FaceTime, Skype, Zoom, Messenger. A number of those are social media platforms, so things like, you know, WhatsApp and FaceTime. They don't have as good a security as, I suppose, other platforms like Microsoft Teams, which is a Microsoft product, so it actually does have better security. Given all of this, you really need to, I suppose, look, we don't have the technical knowledge to actually say to you, use one platform over another, because you know, a lot of that comes back to your own agency, and a lot of you will actually be guided directly by your agency in what you can and can't use. I would suspect that a lot of agencies are in the process of very hurriedly writing guidelines around the use of you know, which technologies and so forth. And so, you know, I would suggest that you either keep in touch with your managers about that, or yeah, see where that's at. And again, you know, what device your client can access. So if your client can access a computer, great, but most of them can't. So you're going to be limited to stuff that you do over the phone. So some practical tips for setting things up. Obviously, a dedicated quiet space is good where no one can overhear you, so you know, you're minding confidentiality. And I guess if you're working from home, that means, I guess, shutting the door, telling everybody, you know, not to come in. You know, trying to minimise interruptions. Make sure your equipment works beforehand. And I mean, look, we've all been in the situation where we've tested it and it works fine, and then we actually go to use it and then something happens. And I mean, look, that's technology for you, and we can't get around that. But if you've tested it beforehand, I guess it's more likely it's going to work. Now, if you're going to use a camera, try and position it appropriately. And I know some people, you know, if you're working from home, you don't want identifying things. So you don't want, you know, someone had a picture on the wall behind them of family members or anything like that. So, you know, a blank wall or whatever you feel comfortable with. I guess ideal is sit facing the camera, Try and keep the camera at about eye level and look towards that space. And one other little tip, if the client's talking, you can lean forward, all right? And it actually does help in terms of, it's what you would do in a normal interview situation. So it's, yeah, you're just using, I suppose, similar skills to what you would normally do. And look, where possible, guide the client in setting up. Again, look, some clients have more technological knowledge than others, and they might need help with downloading and using the software. And if you can guide them through it, do. Set boundaries, both for yourself and for your client, and that is, so stick to appointment times. I think sometimes if you're just dealing with a client over the phone, and I realise it's different with outreach and where you're working with really chaotic clients and they need to ring you, between appointment times and things like that. But try and keep people to appointment times so they're not constantly ringing you and interrupting you. If you want them to do worksheets and whatever for particular sessions, send it well beforehand, so that the client can be well set up with that. Allow time between clients. And I think when you're in the office, you say goodbye to a client, you see them out, you go back to your office, you might write up some client notes for 5 minutes, or you might grab a cuppa, or you might whatever. And some of that is just sort of saying goodbye to one client, giving yourself a breather, and then bringing in the next client. So make sure you're still doing that, even if you're working at home. And the other thing too is clearly document instances where consent is verbal. And we're in a situation now where you may just be dealing with someone over the phone. So if perhaps they're in crisis and you may need to be contacting their GP or other workers or family workers, or family or whatever, make sure normally you would do that in the office and get them to sign consent forms. Again, follow your agency guidelines, because your managers should actually be able to give you some guidance on that. But yeah, make sure you've documented it properly. Remind your client that they should be in a quiet space as well. Standing out in the middle of the street probably isn't the best place. Having their partner there where they can listen into the whole conversation probably isn't great either. Remind them to charge their phone. Sometimes simple things can happen. Predetermine the location where possible, because obviously if you've got the client in the office with you, you know where they are. And if there's a crisis going on and you need to be contacting other people and managing them and perhaps getting help for them, it's a lot easier. Whereas if you have someone ring you who is in crisis, find out where they are. Because if you need to then call emergency services or get someone else in to help, then you know. Have a contingency plan. So what's going to happen if the line drops out, which, as we all know, happens on quite a regular basis. And so what's going to happen if you're talking to someone, the line goes dead. So maybe it's a case of you try and ring the client back immediately. And if that doesn't work, then the plan would be to ring 5 minutes later. And then also consider, I suppose, again, if it's a complex client and someone who needs a lot of support, consider the use of a support person as an emergency contact. And again, that comes back to your consent. In general, managers can do quite a bit to support their staff. So it make sure that, they need to make sure that their staff are aware of all the agency policies and procedures with regards to all of this digital health stuff. As I said, some agencies may not have that in place yet, but I would be willing to bet it's on the way. ensure that your staff have the equipment that's available. Everybody should at least have their own phone. And I'm guessing that a lot of workers will probably have their work computers at home with them. And like as with someone who's in the office, you know, maintain regular line and access to clinical supervision while your workers are off site. And look, something that, and I mean, Naomi's going to follow up with this in some of the discussion we're about to have, but, you know, because you're at home, you know, you're finishing with a client, and then normally you would debrief with all your colleagues and whatever around you. And, you know, that's a way of debriefing, it's a way of getting information. When you don't have access to that, it may well be that you know, you need to access supervision a bit more. Okay, I think that's probably enough from me. The last thing I was going to say is that DHHS are going to be releasing Health Direct to the AOD sector, and that is one of the telehealth, I suppose, medical platforms that they've been using. They're going to be testing it with some small groups of community agencies, and then hopefully they're going to be rolling that out at the end of April. I haven't used it. I don't know what it's like. I know that there are some limitations with group work though, in that, you know, you can only have 4 or 5 people on the line at once. So I guess, yeah, will everybody know as soon as that becomes available. Thank you.
Cool, thanks, Jane. Just to let everybody know as well, we'll be giving out copies of the PowerPoint. So I'm sorry if you were madly trying to write things down, but sorry, Sue. She's like, damn, I was just writing all that. We will definitely be making that available. So, and with perhaps a little bit more additional information as well, some of those links. What I wanted to move into now is a bit more of a free-ranging conversation. I mean, assuming there aren't any questions, if anyone has any questions of Jane or anything that they would like to know a little bit more about with what we've just covered. I'll take that as a no. That was really well covered. So thank you, Jane, for that. Was just this idea that what we're moving into right now is not business as usual from home, that it really does involve a paradigm shift in how we approach the work as individuals, as teams, and also as clinicians. And it's not simply a matter of using a laptop to do work now, or doing work over the phone, or, you know, finding a private space in our house and shutting our kids out while we try to do the work. There's actually a real shift in how we go about it. And that's not only because of the introduction of new technologies and the need to work in this way, but it's also because of what's happening for us in terms of the collective experience around COVID-19. So it's, I guess what we're trying to set the scene moving into these sessions is that it's not just about skills that you need, and it's not just about new knowledge that you need, which you do, but it's not just that. It's also a real shift in thinking, and it's a real shift in thinking around how you approach the work, how you look after your own needs, and in essence, how you view what is really, really familiar territory with fresh eyes. How you look at what you know inside out as though it's new territory, as though it's new land. Because in essence, it actually is, yeah? So we wanted to just open it up to see what people's views were about that, to see what their experiences thus far were, you know, in terms of how you're feeling and your experiences of working in this way, and also what you're seeing from your clients as well. To share some of those experiences and get a sense of what this new normal, in a way, what it actually looks like and what that actually means and requires for us as humans. I mean, part of it, obviously, what Jane was talking around is how we engage with other people, but it's also how we understand our own needs as well. So I will unmute everybody for a moment, just in case, because that's another thing, right? You know, we're so used to working in this way where human conversation and human interaction is not stilted, and it tends not to involve, turning off a mute button. It's fluid and it's dynamic and it's shifting and it's evolving, and it's really hard to do that on a format like this when people are all muted. Clearly what does happen when we unmute everybody is it gets a little bit like anarchy and everyone tries to talk at once. So even just like raising your hands, I'm going to, create some of that non-verbal communication as well. So for those of you with your cameras off, if you feel like popping them back on so we can see if you want to speak, that's great. I think that's also okay. And Cheryl has some contribution.
Yeah, well, I just finished a comprehensive assessment via Zoom at 1 o'clock just before I joined this meeting. She had to have a dual, the client had to have a dual meeting with mental health, myself and her. So mental health actually had her in the room with them and we Zoomed in. We were able to contain it really well. We got on quite well. Yeah, just with that instant rapport on the screen. Had a bit of a few giggles about the fact that, yeah, I'm working from home and they had to be out and about in it. So, yeah, it actually worked quite well. There was a moment where the Wi-Fi kind of dropped out. I just kind of rung on the mobile and I said, do you want to continue on the mobile or wait for it to come back in again? And, yeah, they just said, well, wait. And it was over and done with within about 2 minutes. Found it really easy. So that was my first comprehensive assessment via Zoom in this format.
Does anyone else have anything they might want to add about their experiences so far? Thanks, Sue.
I've actually had to go on by a headset because, if I'm working from home, the dog doesn't like things happening, and this cuts out the noise of him. It cuts out the noise if I've got family members, walking through the house, and it also cuts down the confidentiality aspect. If there is, they know when I'm working, they know when to avoid me, but they can only hear one side of the conversation if they do need to come into the rooms.
And that idea of the personal and the public being almost one and the same at the moment. You are bringing your work, you are bringing clients into your own private space, many of you, and it's how do you still create that sense of connection and engagement, but maintaining that real sense of distance.
I think too. Sorry, Naomi. I think too, with the platform I'm using, I can actually share handouts. I've got a whiteboard that we can draw on. Great. So it's still very roomy-like. I just have to learn to draw on the whiteboard better than I can at the moment. I'm much better with a pen than the whiteboard with my mouse. But anyway, work in progress. My circles are getting slightly better.
Excellent.
Yeah.
It's an improvement already. Because there's this idea, we come into this work because we want to connect with people, right? We come into this work, we want to support people, we want to walk with people through their journeys. And at the moment in a way, we're being denied that to some degree, and it's how do we reframe what connection looks like? How do we re-engage, or how do we engage in new ways, in different ways? And how do we know when we're actually engaging? How do we know when we're having a successful or satisfying interaction? When the usual cues and the usual ways that we understand this aren't available to us right now. Yeah, Daniel.
I was going to say my experience has been, that's kind of been mirrored in your personal life as well, in terms of you spend all day on the phone in one room, and then you go to another room and talk to people in your personal life on a phone. I find, it's just the clarity of the difference between those two things. It's the only difference is two different phones for me, and two different things. But that kind of line in the accounting profession is blurred a little bit. Yeah. And the fact that you could just ring a client on your phone at any hour much easier, like that kind of like arbitrary element is, not that I have to still keep your boundaries, but it just made it a little bit more porous. That's my reflection.
Yeah, and it's how do we keep a check on that, and how do we know where those lines are when they are porous? How do we know when we're overstepping them? How do we know when we need to pull them back? And that's that other really interesting part of this whole dynamic at the moment is part of us is wanting to reach out to people. Part of us is really wanting to reach out and connect with people. And another part of us is told, no, don't do that. Stay, keep your distance, keep your physical distance, move away. And it's how do we hold those two desires at once? And how do we communicate that when we've got these two opposing things that are happening at the same time? I mean, even in the sense of, feeling quite, personally anyway, feeling quite a deep despair and distress and grief for what is happening. At the same time, the exact same time, feeling really hopeful and really optimistic as well about the possibilities and some really exciting things that are actually emerging in this space. How do you feel excited about moving forward when moving forward means uncertainty? All these really... Oh, hello. Someone didn't say phone's on silent. That was my fault. No, I'm kidding. But how do you learn to hold those two kind of opposing, or three or four opposing experiences and emotions at any one time? So this is all really new. Yeah, it's not just let's pick up the laptop and work from home. Let's call a client. There's some really, really different things happening for us all right now. What I might do is I might just pop you all into little groups, do virtual groups on Zoom. Sharon, you're going to be all over this. You've been doing it with other stuff. And just give you an opportunity to reflect on some of this with a smaller group, because I know often speaking in a larger group, people aren't always comfortable with. And it'd be great for people to just come back and share a few of those ideas and share a few of those thoughts and experiences with the larger group. And we'll do another poll at the end. So you're going to get a little notice on your screen in the moment telling you to join a particular group. All you have to do is accept that. Yeah? Does everyone feel okay about that? Yeah? Cool. All right, let's give it a shot. And I'll give you say 5 minutes to have a chat, and there should be about 3 people in each room. So that should hopefully be enough time. And I want you to just have a think about either or, whichever feels most pressing or important for you. But what are some of the things that you've experienced personally that, are different right now? Like how you're feeling, perhaps some of your behaviours, perhaps some of your responses. Or if you feel more comfortable talking about it from a client perspective, then the same question. What are you noticing in terms of client behaviours, client engagement, client emotions? What are you noticing that's different about how you're doing the work now? So I'll pop you into groups, and then you'll all get brought back in automatically after about 3 minutes. Did I say 3? 5. All right. All right, I'll see you all soon.
Break out the group.
I didn't get a chance to.
Hi everyone, welcome back.
Welcome back.
Is that everyone? I think that's everybody. I think we're all back. How was that?
Yeah, right. Good.
Can I just get a show of hands of who talked about what they were noticing about themselves?
Yeah.
A few people? Okay. And so the rest of you talk about what you're noticing in terms of clients? Yeah. Would someone feel comfortable sharing what they discovered in their group or what they explored in their group? And it's okay if you don't, but yeah, Michelle, yeah.
Margaret and I had very different experiences. My role is I actually work with, I counsel the family members of substance and alcohol users. And because they're trapped at home at the moment with their loved ones, they're not able to get away to go out to work or whatever. They're kind of ringing more often and they're wanting the help, whereas Margaret is finding it really hard to make that contact with some of her clients. Margaret would be better to tell you that probably.
Yeah, like I tried to ring them and it's up to them whether they answer me or not. So that's the challenge, if they actually answer my phone call. So yeah, end up sending them a text message and they'll respond to that.
Thank you. Thanks for sharing. I mean, two very different experiences there. Some of Kim's had the same experience as Margaret, that people are perhaps not engaging or choosing when to engage and how to engage.
Yeah.
Thank you for sharing. Yeah, Daniel.
I was going to say I've had more engagement personally. Because it's easier, I presume, to get on the phone.
Yeah. And perhaps, you know, people are, I don't know, this might be making an assumption, but perhaps people are reaching out to talk and to connect about things other than or as well as their substance use. So, you know, hence why we're running a session around mental health in a couple of weeks as well. Those experiences of isolation, you know, make it difficult for people, the stress, the fear, all of those things that don't sit within our usual experiences of work.
Yeah, it kind of blurs our role a little bit, I feel.
And that will be one of the points of discussion next week around what's our primary function right now? What's our primary function right now? You know?
How you cope with COVID-19.
What was that? Sorry, Emily?
Perhaps more focus on supportive counselling, not quite so goal-directed. How can we be goal-directed when we can't even think about what's going to happen tomorrow? You know, you've got to go day by day. Whilst you want to encourage routine and structure, because that's really important, isn't it? But yeah, a lot more supportive counselling and a lot more follow-up. But what we're finding is if clients aren't calling us, then we're following up with them more just to see if they're okay, because they're so, you know, potentially isolated. So.
Yeah, I feel it's a lot of maintenance support at the moment. Like, you know, you're ringing people quite regularly for that maintenance rather than really working on goals strongly.
Yeah. And again, I want you to hold on to some of these ideas and some of these points that you've talked about, because I don't know if all of you will be attending next week, but you can go and reflect and review. But this idea of, you know, the usual signs we get of when we know we're engaging well with someone, when we know we're connecting well with someone, or when we know we've had a successful interaction with someone, that's changed as well. So, but to ensure that we still feel satisfied as workers and to ensure that we still feel that we're making a really positive difference in people's lives, how do we learn to understand other cues? How do we learn to recognise when we are still having a really positive impact on people? Because that's super important, right? That you're able to engage and doing meaningful, important work. Yeah, good, Kim. Ask for a new screen with a camera and microphone. I think that's a great idea. Are there any final comments? I'm just very aware of time, and we have one final little poll to do before we end up.
I suppose I just wanted to say very briefly that I in particular talked about, but we sort of agreed that the boundaries are getting blurred, you know, we would never encourage anyone to work from home usually, or would never encourage anyone to use their own computers, and it's all kind of gone out the window now, hasn't it? So what are the ramifications of that?
And what does that look like now? And how do you still maintain a semblance of privacy? How do you maintain a semblance of groundedness? And that's as well, because you need presence more than ever now. How do you know boundaries?
Yeah, we will be trying to follow in terms of, you know.
Hang on, I'm just going to... 2 seconds.
My battery's about to...
That sounds awful. Getting some feedback.
Yep.
I might just mute people. Sorry, even though
All right.
Trying not to before.
Yep, that's okay. I was just going to say that next week we will actually be looking at that specific topic of boundaries and how everyone's feeling about that, and really just trying to come up with some good tips for people to use while this is going on. And I think, it's also important for people to realise there will be an end to this. I know it feels like we're, it's like, oh my goodness, this is going on and on and on. But there will be an end. And in terms of, all of those issues with boundaries and intrusiveness and whatever, they will come to an end too. So we're just going to be looking at what you can do in the meantime.
Cool. So before you all leave my screen and go back to your rooms that you're still in, I don't know, I might go for a walk, I don't know, we'll see. We have one final poll, again, just 3 questions, just to see which one resonates the most, so we can get a bit of feedback about what was helpful for this and what you might like a bit more information on as well. The other thing I will say is if you want to give us anything, a bit more information about what you would like more info on or a bit more clarity around that, pop it in the chat, or you can just email me as well. But I'm going to launch the poll. There's 2 questions. There you go. Oh my gosh. No, that's all right. Maybe 1 or 2 more people who haven't voted yet. Awesome. And I'll share with you what your answers were so you can get a sense. Have I shared that? No, I haven't shared it yet, have I? Share, here we go. You can see that. So hopefully you like the breakout room discussions, that's awesome. Glad you liked other humans, that's also awesome. We can make sure that happens next week. And really pleased to hear that, we've confirmed what you're already doing, you're already on the right track. I think another key message about that is, sorry, I'm trying to do 2 things at once here. Give me 2 seconds. A key message about that is to trust your instincts on this, right? Like, trust your practice wisdom. As much as we're all seeking that confirmation from the external to tell us, what to do in this really uncertain space, in this really uncertain time, I also really want to encourage you to reach out to each other, to share what you're doing, to learn from each other, because you're all experienced in engaging with people. You all know how to work with people and how to connect with people, and that doesn't change. It's just the way that we do it that's shifted. So you're all obviously on the right track, which is great. So I hope that was useful. I hope you enjoyed it, and we look forward to seeing some of you hopefully next week. And if not, then we'll be popping all this up on the VADA YouTube channel, so you can watch all the recordings as they unfold.
Thank you, everyone.
Thanks, everybody.
Lovely to see you all.
Bye.
Bye.
Thank you.
Bye, everyone.